Hi everyone, this is Dr. Asher Shaikh. I've been practicing since 25 years. In 2014, I had a chance to go to Austria and learn German new medicines. Since then, I've been practicing German new medicine. It has immensely helped me in my practice. It has not only built in that confidence in me that how to handle difficult diseases and cases, but the trust of my patients in me by understanding what exactly is happening in their body has also made them confident. They no longer fear once they hear the whole story from me. And they help me, in fact, by telling their symptoms thoroughly, point by point, which helps me counsel them and treat them. All the difficult pathologies which initially I used to fear are now being treated as at ease. So, my dear friends, today's topic is infertility, and I'm going to solve this or try to teach you through two cases of infertility, how should be the approach in German new medicine. So let me take you on a journey to understand these PPT. So application of German new medicine in cases of infertility. As we all know, German new medicine, all tissue changes other than the injury, poisoning, or deficiencies are due to specific intentional biological adaptation, changes controlled from the brain. These adaptations are initiated by a conflict shock, perception, delusion that caught the individual off guard. Let's learn this scientifically. What is affected is the living organism. It perceives its internal and external environment. When it perceives it that way, it affects the cells, including the nerve cells. Cells comprise of nucleus. Nucleus encodes the genetic material RNA. RNA synthesizes certain proteins, enzymes, and hormones. What it stimulates is the neurotransmitters. What does neurotransmitters do? They signal the mood and the emotions. So you see, my dear friends, how a body internal mechanism is working on your internal mechanism is working and how changes takes place in your body. Neurotransmitters are important in boosting and balancing signals in the brain and for keeping the brain functioning. They help to manage automatic responses such as breathing and heart rate, but they also have psychological functions such as learning, managing mood, fear, pleasures, and happiness. Neurotransmitters are dopamine, serotonin, norepinephrine, acetylcholine, taurine, adrenaline, GABA, glutamate, and many more. What are emotions? Emotions are mental states brought on by neurophysiological changes, variously associated with thoughts, feeling, behavioral responses, and a degree of pleasure or displeasure. It explains the disturbance in human being. By understanding emotions, we can understand the individual. What controls the signals is the perception, delusion. Perception results into new emotions, how you perceive the situation that causes the disease. So, my dear friends, to summarize this thing is living organism is affected by external and internal environment, which in fact, in turn affects the cells, which affects the nucleus, the RNA, DNA. The RNA, DNA synthesizes enzymes and hormones, which are responsible for stimulating the neurotransmitters. These signals lead into emotions, and this emotion individualizes the living organism. So what do we do? How do we proceed in these cases? We have to take the history from the symptoms. Your symptoms tell the cause of the shock you experience or are experiencing now. These conflict shocks are the main cause of all problems occurring in your body. These conflict shocks, if understood properly, after taking the history of the patient by asking him what exactly had happened to him during that time when the disease started, or how did he experience the whole situation that time, makes us understand what he must have gone through that time. Patient usually comes during healing phase or hanging healing phase. As a physician, you have to take patient aware of, as a physician, you have to make patient aware of what is causing injury to him and tell him how to prevent future sufferings. In GNM, we have learned originally the biological survival programs are directed from the organ brain. This is very important for us to understand, because after understanding this, it became very easy for me, even after seeing a CT scan or going through the reports, we understand what exactly is happening inside the body. Then they suffer with this biological conflict. So in order to get the complete cure, you need to consider the symptoms of organ brain. So what is this organ brain? I had made a small animation to understand what is organ brain. So this chicken which flew 100 meters cannot be explained as an uncontrolled reflex. This is because the process of flying is such a complex mechanism, particularly without a head to boot. Thus, we are compelled to consider a coordinated organ brain, one that is capable of directing such a complex process. So the theory went as every plant, animal, and human still possesses such an organ brain. The head brain is the organ that mirrors the organ brain. But there's something more, my dear friends, which we need to know. Let us learn through a case. This is a case of 35 years old lady. She was a housewife. What she suffered was primary infertility, adenomyosis, endometriosis with endometriotic cyst. I have made a slide which can make us understand exactly where the pathology is. Changes of adenomyosis. So these are the reports. I'll show you the slide just now after this reports. The changes of adenomyosis are seen in the posterior uterine wall. Pelvic adhesions are seen. Bilateral 20 to 45 mm diameter endometric cysts are seen. Right ovarian cyst shows spine echoes as usual. Left ovarian cyst shows sediments and septae, probably representing a atypical endometrioma. So you see the size of cyst, and this was not allowing her to get pregnant. She had been to many doctors. She had even done IVF, but there was a complete failure. She came to me when everybody in the city advised her surgery, and she was not ready for the surgery. She was very frightened. She was suffering a lot. Everybody was on her head to get the surgery done. And the family members were expecting her to go for surgery and finish this off. So to understand this, I have made a small diagram. So there is adenomyosis over here. There is endometric lesions. Then there is endometrioma, the chocolate cyst, and these are the adhesions. These were the pathologies overall which she had. Let us understand these pathologies. Adenomyosis into the posterior uterine wall. Adenomyosis occurs when the tissue that normally lines the uterus, endometrial tissue, grows into the muscular wall of the uterus, where it has not to be there. Pelvic adhesions. Pelvic adhesions are bands of scar tissue that may cause internal organ to stick to one another. Bilateral 20 to 45 mm diameter endometric cyst, a big one. Left ovarian cyst shows fine sediments and a septate representing an atypical endometrioma. What is endometrioma? Endometriomas are cystic lesions that stem from the disease process of endometriosis. Endometriomas are mostly commonly found in the ovaries. They are filled with dark brown endometrial fluid and are sometimes referred to as chocolate cysts. Endometriosis is a condition in which the endometrium like tissue grows in location outside the uterus. So now when you get these cases, what questions have to be asked is what GNM guides you. So naturally, what I'm going to ask is, what was the first shock in her life? And the shock is what is going to tell us what she has gone through and which organ is going to get affected because of that. How we get into the cause. So how does GNM help here? To find the exact emotions and perception, it helps us, and to know which organ is getting affected. That will zero down on what questions to be asked. When you put the right questions, this is what the reaction of the patient is going to be, because the patient also comes to know, oh, this was the reason because of which I had fallen sick. And they never thought that this would have been the reason. And when they come to know what doctor is asking, they really open up and tell you everything. How we get into the cause? Let us read the history of the patient. The patient was directly asked that there is some issue with husband or family members because of which you are suffering. As the patient was reluctant on sharing a history, our questions that were targeted around her disease made her share her details with us. There is a lot of anger on the husband and the mother-in-law. She was full control of the house. She has a full control over her house. She doesn't leave me or my husband alone. This is what the patient said. She even comes to movies with us. I want my husband to take care of me and my needs. I just want my husband to be in my company, but she's always there. She means the mother-in-law is always there with them. She won't just leave us alone. She always expects us to abide by her rules. Whenever I feel it isn't right, I do not listen to her. Then we land up quarreling. The mother-in-law and the daughter-in-law land up quarreling. Marriages, I suffered a lot for a year. Mother-in-law used to torture. Things went till divorce. That scared me a lot. Husband never took my side. She had a fear that the husband will leave her. She used to get hurt. I used to get regret, used to blame myself. I used to get furious. I just felt like killing the mother-in-law. I have developed strong dislike towards her and my husband. And also, I cannot express what is going in my mind. I cannot do that. I do all my work. It's my job, but she doesn't care. All these years, I felt that everything will be fine eventually, but now I have lost all my hopes. I am not going to forget this. I keep on thinking all about these past events. Why am I so faulty? She used to think that there is some fault in me. Why can't I just conceive? I desperately want to conceive. Impatient, insecurity. Would I ever get pregnant or not? This is only age. It will be difficult as I grow old. I am afraid of my husband will leave me. Insecurity of being alone. Someone will break relations with my husband and me. I don't want to be pampered. Just consider me, listen to me. Annoyed with mother-in-law, I try to sympathize with her, but she does not like to open up with me. I am also a family member. They should talk to me. They should ask me, but they just neglect me. But then they don't even consider me. I feel lonely, get irritated. Then I am irritated. I can't even tolerate my husband near me. Saddest moment is father died. I couldn't do anything for me. That's the biggest guilt I have. Since then, my menstrual complaints have started. Okay, so here the initial shock was the father's death and the complaints started. She was affected since her father's death. This is the understanding, overall understanding of the case. She was affected since her father's death. Feeling of grief was troubling her. After marriage, all her attention was shifted to her husband, but according to her, she didn't get her importance as per her expectations, and the conflict continued. Here, there was a forsaken feeling, anger towards husband, mother-in-law, which was suppressed, causing the illness, and there was again a fear of that the family will be lost. So, my dear friends, how do we take this ahead? The conflict shock for what we consider in GNM around the ovaries are loss conflict, territory conflict, love, argumental, or betrayal. And if it's the corpus luteum which is affected, it is severe loss. So, what we need to consider is the loss conflict. So, what is this loss conflict? The biological conflict linked to the ovaries and testicle is loss conflict concerning the loss of the loved ones. If you know, my dear friends, if you have read the initial how German new medicine came into existence, we know that what Dr. Hammer had gone, Dr. Hammer had lost his son, and after that he came to know that this loss was the cause of the testicular cancer. The fear of losing a beloved person can already trigger the conflict. Constant self blame following a breakup or death of someone close can keep the conflict active. Women also suffer loss conflict after miscarriage or threatened abortion. A loss conflict can be activated through an argument, betrayal, or unfaithfulness of a partner or a friend. So I have tried to put this in a chart. What did happen was there was a loss conflict on the left corner. If you can appreciate, there was a loss conflict and the body went into sympathetoconia. And when the body went into this sympathetoconia, the ovaries and the uterus were affected. There was a conflict active phase. During the conflict active phase, the patient goes into nervous restlessness, low appetite, dysmenorrhea, vaginismus, cramps, weakness, and peripheral coldness. Okay, so during the conflict active phase, the patient goes into this prolonged sympathetoconia, and then when there is a conflict resolution, the patient develops these pathologies like adenomyosis, endometriosis, chocolate cyst, and PCOD, adhesions, fibroid, and tumors. And once everything is healed, all things get better, then the normotonia sets in. The patient lives his life normally once the healing takes place. So just to understand how the German new medicine is understood is the mesoderm forms the ovarian tissue, and the ovarian tissue is governed by cerebral medulla. Then to understand the cerebral medulla is all tissues which are controlled by the cerebral medulla heal in the form of cell loss. The destruction takes place in the form of cell loss. Then there is a cyst formation to heal the lost tissue. So it affects the psyche. Then after the psyche, it comes to the once the psyche is affected, the cerebellar medulla is involved, and then the ovaries are affected. The injury takes place in the form of cell loss, and the healing takes place in the form of cystic formations. So again, the same thing, conflict active phase, there is a shock, there is sympathetoconia, and there is the ovaries, and the ovaries go into a cell loss when the conflict takes place. What is the biological meaning? Why does the body respond in such a cell loss pathology or problems which come into the patient? Additional ovarian tissue. So when this occurs, there is additional ovarian tissue, tumors produce more estrogen. Why does the cyst happen? This is the answer to this. This gives the woman more sexual drive. She looks younger and has a better ovulation, increased chance of becoming pregnant, and the body compensates in the form of loss compensation. Conflict stress resolution after counseling. The patient to bring him to normotonia. When he comes into normotonia, there is awareness, there is priority shifts, seeing the bigger picture, and there is an emotional relief. Healing phase. What happens in the healing phase? Restoration, inflammation of the ovaries, swelling, pain, one or more cysts grow out of the holes. which begin to fill up with functioning tissue. Ovarian cancers, greater estrogen production. At the beginning of the healing phase, the cysts attach themselves to neighboring organs, which is often mistaken as invasive growth. The cysts detach themselves as soon as they have developed their own blood supply. Healing phase is followed by the parasympathetic scarification, and then the pneumotonia returns. So again, the same slide. So here you see the conflict is death of father and the fear of losing the family. Then there was another one conflict where she was disrespected in the family, and there was a lot of anger towards husband. So the conflict active phase, only this thing stayed there in her body, and it was a continuous hanging conflict which was going on. And after counseling and after telling her what the problem is and how to cope up with this situation, she came to us with this astonishing results. You see the baby coming in, she became pregnant, she did not have to go into any surgeries, she delivered a baby girl who was healthy. These are her ANC reports. The sonography shows a normal baby, and everything after that was normal. These are more ANC reports, which shows all parameters in the reports to be normal. So let us see one more case. This one more case where the uterus is involved. The first case which we saw was the ovaries involved. Let us see this case where the uterus has been affected and how we can take this and solve this case. This is a 35 years old female housewife which has adenomyosis with posterior myometrium fibroid, secondary infertility. So in this chart, I have tried to summarize the whole picture. 35 years age female, secondary infertility, adenomyosis with post-myometrium fibroid. What did she has to say about her husband? She feels neglected. He does not give me time. He doesn't value me, doesn't appreciate me, doesn't respect my emotions. They use abusive words for me. He gets irritated if he speaks that I don't want that. That hurts me more. Weeps easily. I feel better after crying my heart out. So how do we understand this conflict? The conflict was a general conflict, humiliated and disrespected as a woman. So let's see what are the conflicts of the uterus. Biological conflict of uterus are procreation conflict, implantation conflict, mating conflict, which affects the cervix or the vessels, sexual conflict, which affects the cervix, general conflict, which we saw in our case, the ugly gender humiliation. From this picture, we understand what are the different conflicts, the same which I explain you now. But how does the body react? So what is a procreation conflict? Procreation conflict is a person perceives or delusion situation is not right to be pregnant. So not wanting to be pregnant. I had a patient with the same pathology. When she got married, she was told it is a big bungalow. But when she got married, it was a small room which they shifted in. In that small room, there were 5 people: the mother-in-law, the father-in-law, there one more son, and these two, the couple. So she went into a shock. After that shock, she suffered pathology, and then she perceived it like this: the situation or the surrounding is not right to become pregnant. And that's the reason she was not getting pregnant. Wanting to be pregnant but not able to, loss of child, repeated abortions or miscarriages, which is fear of not getting successful. So in that case, we saw the general conflict. She was disregarded as woman. There was gender harassment, and she was humiliated and disrespected as a woman. by husband and the family members. Again, I try to put the whole thing in this chart. If you see the procreation conflict on the left corner, the active conflict active phase, every patient during conflict active phase goes into this autonomous nervous system changes. There is nervous restlessness, low appetite, dysmenorrhea, vaginismus, cramps, weakness, and peripheral coldness. The pathology which the patient develops is adenomyosis and endometriosis. The scarring tissue led into adhesions, fibroids, and tumor. And this is when the patient comes to you. But by right counseling and making them aware, they also not only realize what is causing them or what is a hurdle which is not making them pregnant, but the normotonia returns. So, to understand here, we saw in the ovaries there was cell loss because cerebral medulla was affected, which governs it, got the conflict shock. Here, the endoderm forms the uterine tissue. Uterine tissue is governed by brainstem. So what does happen here? In the first biological law, we have learned the psyche affects the brainstem. The brainstem, which controls the uterus, tries to heal in the form of proliferation of the uterus, mucus cells, or fallopian tube. To understand it biologically, the shock affects and causes sympathetonia. The uterine tissue and the fallopian tissue tube try to come out of this situation by formation or thickening of uterine mucus, which is benign, or a cell proliferation, or may grow into uterine cancer. If it is a fallopian tube, the fallopian tube show blockages because of the cell proliferation, and the ovum cannot be transferred. How we understand it biologically is there is thickening of the uterus lining to increase the chances of a fertilized egg implantation. The healing phase is the parasympathetic phase, where the fungi, bacteria remove the uterine cells, which is not needed. So what happens? The patient suffers from endometriosis, salpingitis, menorrhagia, night sweats, vaginal discharges, and uterine candidiasis. Let's see another case. I'm trying to take you into 3-4 cases where how the pathology changes your approach and how you can understand the case in depth. This is again a secondary infertility with PCOD case. She was unable to conceive in spite of the hormonal treatment. Her age was 34, secondary infertility, PCOD. With this lady, the history came as she first delivered a girl child and was always taunted by the mother-in-law for the same. She said, the mother-in-law used to say, I don't want another girl. And then she went into this conflict shock. She was having this fear that what if I deliver a girl child again? I again have to hear all the insulting words and taunts. There used to be constant arguments in the family. I used to get fed up, but kept quiet, so I don't lose the family. Again, the loss conflict, the argument conflict, fear of losing someone is what affected her, and that's the reason she was not getting pregnant. So here again, the biological conflict was loss conflict, cell loss, ovaries, where the ovaries compensate by forming cysts, which is called as polycystic ovarian disease. The other case of a chocolate cyst. Now, this case was a big surprise for me because if you see the age is 39 and she is into primary infertility, and they've gone to all the doctors, and all the doctors had said that it is your age now. I don't think you will conceive. They also did her anti-Mullerian hormone, which was very less, which made them come to a conclusion that she will not get pregnant. This case was referred to me by a gynecologist. And to my surprise, I was again successful and they got this baby girl. What was the history? The history was the female said, I didn't want pregnancy, until we get settled down. I used to stay home, look at my mother-in-law. I had to do all her nursing. Mother-in-law was dominating. I did everything as a responsibility, but that irritated me a lot, which I had to swallow. I did not reach out for fear of losing the family, as I already lost few loved ones in my family. So there was again the loss conflict, the fear of losing the family. She did a lot for her mother-in-law. She nursed her, but again there used to be arguments. Even after doing so much for the family and the mother-in-law, she was not respected. She was humiliated. So again, the same story repeats itself. And when we understand this, it becomes very easy to solve all your cases. I have this video where they come happy, smiling, and everything is fine. So how does it work? The psyche, compulsive thinking, preoccupied with the conflict. The patient is always preoccupied with the conflict. The brain thing shows hammer herds in the brain stem on CT scan. If it is a uterus, the organ proliferation of the uterine tissue occurs. So these are the hammer herds, which you can appreciate in the CT scan of the patients. This is a very extensive topic. We can learn this later on. Here you see the brain stem and the uterus and the endometrium and the prostate gland is controlled by the brain stem. So to summarize, my dear friend, I took this slide from Dr. Hammer's book, which shows the compass of German new medicine. The cerebral cortex and the cerebral medulla control organs, show cell loss, ulceration or necrosis. Tissue restoration is with bacteria. When it is a cerebellum or the brain stem, then the tissue responds in the form of cell proliferation. Then later on, the cell removal occurs with fungi and bacteria. So my dear friends, with great respect and honor, I pay homage to Dr. Hammer for his achievements in medical research. His knowledge has enlightened our paths. Thank you and see you soon. Thank you. Thank you, Dr. Verghese, for making me come on this platform and give the lecture on infertility. I congratulate you all for making this global GNM platform, which is going to enlighten the paths of many physicians years to come. Thank you.